Well, good afternoon, everyone, and thank you for attending the 2024 Nurses Month Award Ceremony. Today, we come together to honor and celebrate the nurses and nursing staff that have dedicated themselves to caring for our nation's heroes. For today's award ceremony, we are privileged to have several guest speakers, along with many talented and innovative recipients of the Nurses Month Awards. Just a few items before we get started. As each award nomination is called, please come to the podium to receive your certificate. If the recipient of the award was not able to attend today's ceremony, the award will be sent to the nurse manager for them to distribute to the applicant when they are able to. Also, if you have qualified for more than one award today, you will only receive one award with the exception of the Secretary's Award. Moving along to our first speaker for today's ceremony, I would like to introduce Natalie Palmieri, Deputy Associate Director of Patient Care Services.
Good afternoon, everybody. Welcome to the Nurses Month Award Ceremony. So today's celebration closes out a very busy month where we honor and show gratitude for the work nurses do to provide comfort, promote healing, and advance the science of and the innovation within our profession. Serving alongside and supporting our organization's nurses, whose mission is made all the more meaningful given the sacrifices of the veteran population that we're so proud to care for. It's an honor I don't take for granted and a responsibility that I know that those that we're here to recognize don't take lightly. Indeed, the individuals that we're here to celebrate, including our Secretary's Award nominees, new registered nurses who have completed projects in the course of the Transition to Practice program, the accomplishments of our PBR and our residents, Daisy and Sunshine Award winners, numerous advanced practice nurses who are leading research and performance improvement projects to advance care, the multitude of nurses who have been published in peer-reviewed journals, and other honorees have demonstrated their commitment to the art and science of our profession and are truly exemplars of what it means to possess the heart and the mind of a nurse. So once again, thanks for joining me as we honor and recognize the achievements of our VA Northeast Ohio nursing team. The dedication and compassion of my colleagues who we are here to celebrate today, it's personally inspiring to me, and I'm sure it will be inspiring to you as well. And with that, I believe Chaplain Hankins is up next. Started us off with prayer and reflection. Thank you.
I love VA nurses. For over 22 and a half years now, starting out in San Antonio in a year program and came here 21 and a half years ago. If you need a poster child for a cheerleader for nurses, that's me. Love what you do. Thankful for what you do. I wore this uniform on purpose to give an illustration. My life dramatically changed after wearing this uniform. And I get my care here by choice. And I can tell you firsthand the benefit that I received of having nurses at my side at various moments in my medical situations. Thank you. And I'm glad I'm called to ministry and not medicine. I don't do needles, blood, bodily fluids, all that. I'd become a patient if I had to deal with that. So I thank you for all that you put up with. Now, I was told to give a brief prayer and then some words of encouragement. So I set my timer for 33 minutes, and I'm sure that I can get that all done within that time frame. Just kidding. But I wanted you to know my heart before going into prayer. So let's give thanks to the one who made us like he made us. God, we thank you for whatever it means to be made in your image. It blows our minds, but whatever it has to do with, it has to do with love, because that's what you put in us. All our bells and whistles, they go off when we love, when we serve, when we care, when we share, when we involve, when we promote, when we celebrate. Thank you for that. And I thank you for these nurses who put up with so much, especially from us veterans. And I thank you that there is a system in place to recognize good hard work. But I thank you that you see every act of kindness and every act of service. And you keep us going, even if there isn't the recognition in the system. And I pray at this time that you would bring more nurses into the VA like I've been beating on your door all these years. Please, God, continue to bring more nurses so that they can share the load, that there will be less burnout. Father, that their skills and their care and their tenderness at that bedside will be as strong as ever because they have sufficient staffing. Help the administration all the way up to realize the need for that most important part of healthcare. We ask this in your mighty name. Amen. So, that poster child for cheering you on has one for you. Most of you that know me know I'm always telling clean dad jokes. So I got one for you. Nurse comes running into the doctor's office. Doctor, there's a man out in the waiting room who says he's the invisible man. What do I tell him? The doctor says, tell him I can't see him. You all go into circumstances that can make me weak in the knees. And the things that you do and put up with blows my mind. That is seen and known even though we can tell ourselves that it's not. So I just want to encourage you, just like I did with all the new incoming nurses many, many years ago. They had an orientation and they had a chaplain section, and I would tell them, don't ever take it personal when a veteran goes off. We veterans, we're a unique bunch. We can be vulgar and a knight in shining armor in 5 minutes. We have all kinds of things rattling around in our heads because of wearing this uniform. Seeing and doing things we wish to God no one would have to see and do. And there are a number of things that can trigger us, and all of a sudden, we're in a different place in time. And you're the poor soul that's catching it. And I have been so rocked by seeing how you all take that on. And that's why I love the VA care over private care. Because here in the VA, you take us veterans on, all of us, our baggage and all. Do not miss that point. I know there's good benefits and all of that. But what you do with your skills and your love and your care, that is what makes the VA care special. And so keep going. Keep putting up with us having our moments. Keep showing who you are in the face of all that mess. Because it's precious. You can make the difference in that moment, that medical situation. And you can make the difference of whether a veteran decides to say checked into life or checked out of life. And I'm not putting the burden of that on you. None of us can carry that. We veterans understand we've got our baggage, but I cannot overemphasize the importance of looking into your eyes when I'm in that medical situation and I see care in spite of me being a pain in the you-know-what. So what you do is precious. And whether you get recognized for that or not, I'm going to tell you, it's nice to see the awards. It's irrelevant if you're not showing that love and care at the bedside. So please, from this veteran who loves you so much, please take care of yourself. Let love come in to you so you can continue showing love to others. Amen? Amen. Well, then I'm done. See, and I just ran out of time. God bless the rest of your day, and thank you for being a nurse.
All right. Well, Chaplain Hankins, he hit a lot of common themes that I'm going to touch on today. I hope I could bring the same energy that he did, but that's going to be a bit of a challenge. But thank you for having me here this afternoon to celebrate the culmination of an amazing month, our favorite month, Nurses Month. And I wanted to start off by saying that, I respect every clinical profession at the highest level, but one shines brighter today, and that is nurses. Today we celebrate the various award-winning nurses who have poured their lives and provided world-class care to our veterans here at the VA Northeast Ohio Healthcare System. And a lot of you know nursing holds a special place in my heart. When I started at the VA about 14 years ago, my first position here was an HSS in nursing service. And that really gave me a firsthand view at all of the miracles that all of you make happen on a daily basis and everything that we're celebrating today. In reflecting on that, some of those key attributes, really came to light in thinking about all the work that, I've partnered with nursing on over the course of my career. One of the first items that pops up is toughness and teamwork. I think that sums up nurses very well because, first of all, as Chaplain Hankins referenced, just the toughness to endure such a mentally, spiritually, and physically draining job and to still have a smile on your face, be pleasant, that's amazing. It truly is remarkable. And then as far as the teamwork, I really think nursing epitomizes teamwork at the highest level. Working with nurses on numerous interdisciplinary teams over the years, I can think of numerous examples when this has been highlighted. One particular example back in the day when we were replacing all of the acute care mattresses. We were struggling to get volunteers to help us out, and there was some type of turf battle going on between other services. And I was moving all these mattresses, and two nurses, I won't name any names, but they stepped up to the plate and were lifting these mattresses, dragging them, and both of these women were actually pregnant at the time. And they woke that place up, and all of a sudden, services became a lot more inspired to help out. And that story just sticks with me. I'm just like, wow, like right there, teamwork, toughness at its core. So nursing teamwork is elite, and I'll leave it at that. It has also been awesome to see just the persistence of nurses that, maybe they didn't have the most infamous job, not the sexiest job, so to speak. Seeing those people fight and grind their way into those, assistant nurse manager, assistant chief, and chief positions. That's just been awesome to watch. Puts a smile on my face. So that's another thing that really pops out. And then finally, commitment. As you look around the room, a lot of us, all of you, have been here for extended periods of time. And within the healthcare industry, that's not normal. We are not normal. You guys are not normal. You have poured your lives and careers into nursing, and it really touches my heart, because you guys are phenomenal, and I just wanted to point that out. Just having that commitment to ride with Cleveland as long as you have is awesome. So on behalf of the ELT, thank you for your undying passion and effort in providing world-class care to veterans. And lastly, thanks for being the coolest. I love you guys.
And now we would like to show a video by Dr. Saslow and Dr. Strawn.
Greetings, fellow VA nurses. I'm Dr. Christopher Saslow, Assistant Undersecretary for Health for Patient Care Services and VHA's Chief Nursing Officer.
And I'm Dr. Jennifer Strawn, Executive Director for the Office of Nursing Services and Deputy Chief Nursing Officer.
So throughout the month of May, we honor and celebrate the unwavering dedication and commitment of our nurses across the nation. Here at VA, we take immense pride in acknowledging the remarkable efforts of our more than 122,000 nursing professionals who consistently deliver exceptional care to our veterans.
Embracing the theme Advancing Nursing and Transforming Healthcare, we spotlight your pivotal role in shaping patient care. VA nurses represent the core values of compassion and excellence, driving forward advancements in nursing and healthcare transformation to improve healthcare outcomes and care experiences for veterans.
2 years ago, we embarked on a journey guided by the Nursing Workforce Strategic Plan, a comprehensive 10-year roadmap designed to align with VA's healthcare priorities through 4 strategic pillars. The first, optimizing and informing nursing practice. Second, strengthening the nursing workforce. Third, reimagining our lifelong learning and career development. And finally, inspiring an industry-leading culture. At the Lewis Stokes VA Medical Center Northeast Ohio Healthcare System, your actions exemplify the core values outlined in the VHA Nursing Workforce Strategic Plan and VA's healthcare directives. Here are a few notable ways that you've made a significant impact. You've achieved a notable CMS 5-star rating for quality measures, a testament to the high-quality healthcare your nurses provide to those who serve our nation. Your steadfast dedication to excellence is evident not only in the care for each veteran, but also in your resilient pursuit of professional development, with a continuous increase in the number of nurses achieving national certification. Your recent reaccreditation as the Shared Governance Organization in January of 2024 underscores your dedication to empowering nurses in decision-making processes, which directly impacts the advancement of the nursing profession and patient care outcomes. Each of you play a crucial role in optimizing and informing our nursing practices through your clinical expertise, utilization of evidence-based practice, and continually raising the bar on quality improvement initiatives. Your engagement in research, innovation, and educational pursuits not only elevates veteran care, but also influences the broader healthcare landscape.
This Nurses Month, we celebrate you, our VA nurses, whose dedication, resilience, and compassion embody the VA's mission, ensuring every veteran receives the highest quality of care.
So on behalf of all of us at the Department of Veterans Affairs, we extend our deepest gratitude for everything that you do. Your work is truly appreciated, not just this month, but every single day. Have a wonderful Nurses Month, and please take a few moments to reflect on your own invaluable contributions and to celebrate yourselves and your teammates.
If everybody can just give themselves a round of applause, I want to thank everybody for coming today. I just want to say that any award recipient, if you can come up to the left, and when you receive your award, go to the right and get your group picture taken. So we're gonna start off. I wanna introduce Kim Pyatt. She is the chief of the Community Living Center. Kim Pyatt.
Hello, everybody. I am going to be presenting the Secretary's Award for Nursing Excellence, which, as a sidebar, is the highest nursing award that you can win nationally, and you can only win it once nationally. But I'm going to give you a little bit of background. The VA Secretary's Award is Nursing Excellence Program, established in 1984, annually honors one medical director or nurse executive. It honors one registered nurse in a staff role and one in a non-staff nurse role, such as advanced practice nurse, nurse manager, instructor, etc. An LPN, or what some facilities call an LVN for licensed vocational nurse, and a nursing assistant actively engaged in the care of patients at our medical centers. The recipient's contributions to the care of patients in any of the VA healthcare settings are patient-driven and demonstrate such excellence as to merit recognition from peers. Again, this is only given once nationally. So we're going to start with the RN Expanded Role nomination. This award nominee continues to develop and implement strategies to improve organizational performance related to resource utilization. This individual has been instrumental in assisting the Community Living Center, working with quality, the CLC Excellence Coordinator, and the Community Living Center Chief Nurse to develop action plans for the Acela Vision 10 surveys and correct any findings. She meets the team weekly to discuss strategies and on how to improve issues or concerns that were mentioned in any previous surveys. She uses staff expertise to assist with realistic goals and interventions to increase survey readiness. It is an all-hands-on-deck perspective. The Community Living Center neighborhoods focus on their weak points and discuss the outcomes and interventions created to each team member to better prepare for them for the survey as well. It is an inclusive team approach. I'd like to congratulate Catherine Wilson, Nurse Manager of CARES Tower 2. Congratulations. Here's your pin. Oh, it looks like we're going this way. I think he was taking one now, right? Doing it now. Psst. Come on back. Congratulations. Thank you. And our second is for our nominee for the RN staff nurse. This person establishes and maintains a personal development plan to support professional career development with demonstrated innovative outcomes in nursing practice. This individual is active on several committees in the organization. He is on the disruptive behavior, suicide prevention and safety planning, and employee engagement. He firmly believes to make changes, you must be engaged and involved. This RN believes that serving in this capacity elicits change. He can bring forth concerns of the bedside nurses to administrators and leaders. He is also in school to finish his bachelor's degree in nursing, nearly complete. He has a desire to continue his education for grad school. I'd like to congratulate Dante Antonino, Assistant Nurse Manager of the Emergency Department. I guess he's not here. So we'll save that for his manager. Now going on to our LPN nomination. This person is an excellent and exceptional LPN whose focus is to improve the delivery of care provided to the veteran. This nominee goes above and beyond the call of duty on a routine basis. She works diligently daily to serve veterans and their families. She is truly driven by an earnest belief in the VA's mission to fulfill President Lincoln's promise to care for him who shall be borne the battle and for his widow and his orphan. By serving and honoring the men and women who are America's veterans, She goes above and beyond her individual and organizational responsibilities daily. This individual has been an LPN on Caris Tower 4, now Caris Tower 2, for over 10 years. She is a very experienced nurse with a strong background in medical surgical nursing, critical care, wound care, and long-term care. Her blend of experiences makes her a very strong nurse in caring for such a medically complex population with many different needs. She has a very strong skill set and utilizes critical thinking throughout the day. Not only is this nominee knowledgeable in experiences, but she has personable and is open and caring, which makes her an approachable resource to staff members and veterans alike. I just want to state that this nominee also won the Vision Level nominations as well. I'd like to congratulate Mary Ellen Minter, LPN. And last but not least is the nursing assistant or healthcare technician nomination. This person consistently works with the RN and healthcare team to provide outstanding care to the veteran patient. She is a member of the 4A Skincare Champions. The nursing assistant is involved in weekly skin rounds, assisting nursing staff in essentially assisting with all patients' skin and head to toe, assisting in applying appropriate interventions, and communicating with nursing staff observations with her scope of practice. She recognizes the importance of performance improvement measures and related to decreasing the risk of hospital-acquired pressure injuries. This nominee recognizes the importance of central line-associated bloodstream infections in the 4A oncology population, as they often have central catheters. She is a leader in ensuring that patients admitted with a central line or get a new central line have appropriate signage indicating a chlorhexidine bath is provided Monday, Wednesday, and Friday per hospital policy. She accurately documents when the task is complete. In collaboration with the nursing staff, this nominee ensures that the at-risk population is receiving this chlorhexidine bath by attending safety huddles, referring to the actual acuity sheet, and the communicating with the RN. So with all that, I'd like to congratulate Jessica Huckabee, nursing assistant. I know she's not here today. Yeah, she's not here. So thank you to all. You've all earned this, and you've done a fabulous job. We're very proud of all of you. Thank you.
Hello, good afternoon. I have the pleasure of talking about the Transition to Practice program here at the VA, better known as TTP. So the RN-TTP is a program for newly graduated RNs focused on the advancement of clinical, leadership, and scholarly skills with an emphasis, obviously, on caring for our veterans. The TTP program is a comprehensive 12-month standardized curriculum designed to assist the postgraduate nurse in the transition from entry-level novice RN to a competent and confident professional RN. Our TTP program work on evidence-based projects, and so we'd like to recognize some of the projects that they worked on today. The first group, which were unable to attend but we would still like to recognize, is the project Supplement Administration and Documentation by Kayla Millsap, Michael Murdoch, Mariah Crawford, and Gloria Onwubenyu. And I'd like to call Latasha Wade to the podium, please. We'd like to recognize her project regarding infection control. Oh, I'm sorry she's not here either, but we'll recognize her. Oh, she is here. She was all the way in the back. Unfortunately, we have another group that was unable to attend. Their project was regarding external catheters, Fantasia Zanders and Yohami Bonilla. Congrats to them. And our final project, Mobility Matters, the impact of participation in a walking program on outcomes and satisfaction for veterans on a med-surg unit, a resident-level evidence-based practice project. And the group that worked on this group was Charles Turner, Kayla Lewis, D'Angelo Green, and Tanisha Bunda Russ, and Jelena Venn. And I know that some of them are here today, so please come on up. Nope. Nope, that was from the first. Oh, sorry. Charles Turner. Congratulations, Charles. Kayla Lewis. Jelena Venn. Congratulations to you. Oh, sorry. And do the rest. Come on in. We'll take a picture. Thank you, guys.
Good afternoon, everyone. I'm Denise Matthews, Chief Nurse for Psychiatry, and it's my privilege today to go over the DAISY Award, the DAISY Nurse Leader Award, and the Sunshine Award. So first I'll do DAISY Award. This is an international award that recognizes the superhuman work nurses do for patients and family every day. This award gives staff, patients, and families a way to express their gratitude for the compassionate environment nurses provide. All advanced practice nurses, registered nurses, and licensed professional nurses are eligible for this award. So with that, I would like to call Donna Price, RN, and Jessica Greer, RN, to the podium. Donna Price won the award in November of 2023, and Jessica Greer won the award in February 2024. All right, and next we have the DAISY Nurse Leader, created to recognize nurse leaders who fully support their direct care staff. These leaders understand the impact staff have on patients and their families. Despite working under tremendous pressure through their leadership, these nurse leaders provide a haven of safety for staff. In this environment, nurses are inspired to do their very, very best. These leaders provide a setting where compassion is valued, and staff, in turn, treat patients and their families with deep humanity. And so the DAISY Nurse Leader Award winner, I would like to call Cheryl Thompson, Nurse Manager, and Rachel Zaba, Nurse Manager, to the podium. Cheryl accepted Cheryl accepted the award in October of 2023, and Rachel accepted the Daisy Nurse Leader Award in March of 2024. And last but not least is the Sunshine Award, a recognition program unique to the VA Northeast Ohio healthcare system. It recognizes outstanding nursing assistants, surgical and healthcare technicians who support VA nurses in caring for our nation's veterans. Nursing support staff are vital to the healthcare team. The Sunshine Award offers a way to recognize these individuals for their remarkable care. The DAISY Award recognizes the exceptional and compassionate care provided by RNs, LPNs. However, without a little sunshine from our support staff, DAISY nurses can't grow. I'd like to call Michael McKinney, NA, and Lydia Rucker, NA, to the podium. Michael accepted the award in August of 2023, and Lydia accepted the Sunshine Award in April of 2024.
Good afternoon, everyone. It's good to see everybody here. I have the opportunity to present some of the great projects that have been accomplished in the organization by our colleagues, both IDEA leaders as well as their coaches and team members. These are projects that continue to advance practice across the organization. And this also helps us to our journey to excellence through research, evidence-based practice, and through performance improvement initiatives. So here are some of the projects we'd like to acknowledge. So our first one is called Mobility Safety Screen for High-Risk Hemodynamically Unstable Intensive Care Patients. So I'm pleased to have my colleagues join me here, Anita White, Paula Sheridan, Nick Wheatley, Vanessa Holcomb, and Lisa Nealon. Now, Nick and Paula and Anita, don't go too far, because we have some more. So the next project, called Track the Yak, Don't Yak Back, is by our three colleagues here that you see here for SICU. So again, congratulations. And one more. Stay put, but we need some colleagues to join you. Jessica Greeny and Ned Sormaz. Kelly Peters. So our colleagues here conducted simulation open chest in the SICU. Congratulations. No, don't you worry about me. Okay, we also have another well, sure. That's right. So the next one is Care the Critically Ill Patient Receiving Nutritional Support. And again, this is Anita, Lisa Nealon, Melanie Spann, Kristen Brown, Paula Sheridan, Nick Wheatley. Please join us. Our next project is improving the effectiveness of communication among caregivers. This was conducted by Tammy Jimerson from the MICU, Mark Carr, with the support and coaching from Lisa Nealon. Stay put, Lisa. Oh, sure. These are all my staff. They're wonderful. So the next one is Rapid Response Program, Training and Algorithms in the MICU. So this is Rachel Zimlich, Celeste Cornelius, Anita White, and Lisa. Congratulations, great work. Our last two projects is by Pam Harvey, so I'd like her to join me. So when Pam was a nurse on CTB, she conducted a project called Impact of a Structured Hydration Program on Long-Term Spinal Cord Residents, and I was happy to be her coach for this project. Stay put. Because our final project is also by Pam, Improving the Effectiveness of Communication Among Caregivers, and this was an HRO project. Congratulations.
Hello again. I have the pleasure to tell you about another residency group that we have at the VA here called the Post-Baccalaureate Registered Nurse Residency. It's a program developed through the Office of Academic Affiliations for newly licensed RNs in their first role after graduating from their nursing program. It's 100% protected time during their first year, aimed at enhancing the new graduate RN's clinical competence, confidence in practice, and leadership skills. Their mission of the PBR&R program is to provide new baccalaureate nurses with a one-year transition to practice training program that incorporates robust clinical and didactic experiences and facilitate role socialization, clinical competence, interdisciplinary collaboration skills, and the confidence to practice independently while equipping them with the level of preparation needed to deliver high-quality care to our veterans. I'm going to call the 5 PBR&R residents up here, and then I'll tell you what they've done since they started this past fall. So I'm going to call up Elise Benedict, Lillian Brazine, Alexis Estrada, Kevin Kranak, and Meredith Joyce, please. So these new RNs started in the fall, and I'd like to tell you what they've accomplished since then. They have had professional presentations at conferences. The first was Gaining Confidence for Practice Through the Eyes of Newly Graduated Nurses at the Ohio League for Nursing this year, the Education Summit. Then they presented at the Tri-State Nursing Excellence Symposium, Leveraging Confidence in Education and Practice Through the Eyes of Newly Graduated Nurses. And to the Nurse Leadership Council here, the impact of purposeful hourly rounding for veterans living in the long-term care areas, a resident-led, evidence-based project. So congrats to you guys for those. But there's more. But there's more, and I'd like to call Nick Noggle up. So, along with Nick, and is Holly Holland here? Holly's not here right now, is she? Okay. And with these 5 new nurses, they also were just recently published in the Journal of Radiology Nursing, which will be out in September, Enhancing Transition to Practice, a Radiology Experience Program for Newly Licensed Registered Nurses. So congrats to you guys. Thank you so much. Thank you all. Thank you, everyone.
I'm here to talk about the recipient who is receiving the American Academy of Nursing Honorific Society membership. She's a fellow in the FAN, and it's a federally focused policy organization. A member called Fellows of the Academy are selected through a rigorous nomination process. Academy Fellows are inducted into the organization for their extraordinary contributions to improving health locally and globally, and are designated with the credential FAAN, which stands for the Fellow of the American Academy of Nursing. The American Academy of Nursing serves the public by advancing health policy and practice through the generation of synthesis and dissemination of nursing knowledge. More than 3,000 fellows in the organization represent nursing's most accomplished leaders in policy, research, administration, practice, and academia. I would like to call Laura Goliath to the podium. Laura is a passionate advocate for team training to improve patient outcomes and is an appointed member of the American Hospital Association Team Training Advisory Panel. She has guided team training programs for over 5,000 national and international healthcare professionals, delivering several AHA webinars designed to promote effective ways to build teams. Thank you very much. Oh, you're welcome.
Hello, everybody. I'm Celia Berry. I'm the Assistant Chief of Acute Care, and today I have the pleasure of announcing the Faces of Award. This award celebrates excellence in nursing and will be presented on Saturday, June 8th. This award will be presented by the Cleveland Magazine and the Ohio League of Nursing, and will be recognizing the honors and honoring the nurses, students, and educators who have made, can't hear me? Uh-oh, do I gotta say it over? But the Faces of Care Award is the award that will be presented by the Cleveland Magazine and the Ohio League of Nursing, and will recognize and honor nurses, students, and educators who have made a positive impact in the Northeast Ohio nursing community. We are proud to share that our very own Stanley Carlton Betts, Nursing Education Program Director, is the recipient of this 2004 Faces of Care Award. Congratulations. You're welcome.
Surprise, I'm here again. So one of our recipients was able to show up. So I just want to remind you guys, this is for the Secretary's of Excellence Award in Nursing. It is an annual award, and you can only win it once nationally. But this is one of our local winners. So this is for the RN staff nomination. This person establishes and maintains a personal development plan to support professional career development with demonstrated innovative outcomes in nursing practice. This individual is active on several committees in the organization. He's on disruptive behavior, suicide prevention, safety planning, and employee engagement. He firmly believes to make changes, you must be engaged and involved. This RN believes that serving in this capacity elicits change. He can bring forth concerns at the bedside nurses to administration and leaders. He is also in school to finish his bachelor's in nursing, which was nearly complete, and his desire to continue his education in graduate school. And I'm just here to tell you he was late because he was in a medical emergency. So he took that patient care over receiving his own award. So we appreciate that. And I'd like to congratulate Dante Attanato, the assistant nurse manager. Thank you. Congratulations. Thank you.
Good afternoon, everyone. Can you hear me okay? All right. So, going a little off script, but that's usually how it works. My name is Jessica Vitaclough. I'm the Assistant Chief Nurse of Operations. I first want everyone, if you could give a round of applause to our fabulous nurse recruiters who put on this day. Thank you very much. So I have the honor of calling out our Florence Nightingale Award winners, and I'm going to tell you a little about what those winners and how they got nominated. So this is our final award recognition for our ceremony today. And this award is inclusive of our nursing staff from the medical center and outpatient clinics, where peers from the same unit nominate one another. The criteria for nomination include: this person exemplifies nursing excellence and provides inspiration to future generations of exceptional nurses who will follow in their tradition. What an honor it is to be nominated by your colleagues and coworkers that you work day in and day out with. So here are the list of names. I believe the first list I have are those that are confirmed in attendance. So when you come up, grab your award and your pin, and then you'll gather for a photo together. So here we go. There's a list of them. So Armando Calderon from the operating room. Berlin Fry Vark. Beverly Wallace, Specialty Clinic Urology. Christine Patrick Lukic, Warren Seebach. Sierra Bonner, CTB. Daphne McCaleb, Nursing Education. Diane Owens Hall, 3B. Donna Rosen Parma-Seebach. Gail Stam, Women's Health. Gertrude Kozak Mickham. Jessica Pompolis, Outpatient Surgery Center. Julie Scott, Telehealth. Lesson Ambersley Koch, WCT2. Linda Flamsch, Home-Based Primary Care. Mary Barrett, PACU. Maureen Kaiser, 4B. Michael Call, WCT5. Neil Fleming, Mental Health Ambulatory Care Clinic. Pamela Koharic, Lorraine Seebach. Rhea Gibson, Primary Care Clinics. Riza Ammer McHugh. Stella Braun McManus, PCU. Teresa Ballion, Inpatient Hemodialysis. And last but certainly not least, Xanthropy Woods, Blind Rehab. Congratulations to all of our Florence Nightingale winners that are here. Oh, let me look at my list. Midtown Dialysis. Well, Mary Pat, do you want to introduce? Tom Gibson, Midtown Dialysis. As you guys sit down back to your seats, I'm going to go ahead and read through the winners that were not able to attend today. Aileen Nihas from Same Day Center. Alexandra Dunn, New Philly Seebach. Amanda Anton, 5B. Christine Hurd Clem, Sandusky Seebach. Cynthia Duran, Specialty Clinic Medicine. Debbie Karazecki, Nursing Supervisor. Davida Locken, Psychiatry Float Pool. Jacqueline Serbaugh, Access Management and Care Coordination. Janice Tench, Personal Health. Joan Jenkins, WCT 6. John Duhigg, 4A Oncology. Julianne Braylick, Akron Seebach. Catherine Novoslisky, SICU. Caitlin Pavlik, Dom. Kiki Ginn, WCT 3. Linda Gemma, Canton Seebach. Lisa Merritt, Akron Seebach. Lisa White, Youngstown Seebach. Margaret Hall, Interventional Radiology. Marianne Reagan, MDS and Restorative. Marissa Longwell, East Liverpool. Mark Tellisman, Lake Seebach. Melissa Brenner, MICU. Patricia Melanick, Telehealth. Roberto Gonzalez, 4A MedSurg. Samantha Willis, CT4. Sandy Roche Thorpe, Specialty Clinic Surgery. Poor Swan Thoranacorn, Nursing Operations. Sean Uhas, Ravenna Seabach. And lastly, but not least, Tanya Cox from Hospice. Thank you all very much.
As part of our annual tradition, for the Florence Nightingale Awards, we do a gift basket, and it's just for one person that we do a random drawing. So everyone's names who are entered into, or every Florence winner will put their name into this bag. So would you like to draw the name? And this is for those that can attend and were not able to attend.
Sean Uhas, Ravenna Seabach.
So the winner is Sean Uhas, Ravenna Seabach. We'll make sure we get that out to him. And that concludes today's ceremony. So thank you, everybody, for all that you do, all the work that you do for our veterans. It's greatly appreciated, and I hope you guys all have a great day.